So what's that going to do? Excuse me. So most notably, agents and brokers are gonna somewhat be forced out. They're not going to receive commissions like they have in the past from companies. In fact, Aetna and some other of the big companies have already phased that out. They're leaving it up to the broker to go to the client and ask the client to pay them instead. If you're a broker in the individual market, you're probably not going to have a job come 2014. It's just simply not going to be a market for you, most likely. Others are working out deals with insurance companies where they'll get a one-time fee for signing up a client, maybe like $30 one-time fee, instead of a few $100s a month. I mean, this is big. Their livelihood is really at stake here, and the insurance companies just can't pay it out because, again, all these commissions come out of that 15% side of the equation. Now, some other folks that are going to be hit hard are those plans, those insurance companies that have limited or they're called mini med plans. And those are plans that have low coverage. They typically don't have or meet the $750,000 threshold for essential benefits per the law, and they're really designed for people that don't have really nice, really premium insurance through their employer. They may be paying out of pocket, or maybe they have limited benefits through the employer. Whatever the case may be, it's coverage and it's something. The Health Care Law, the Affordable Care Act says that that's no longer legal. So all these people would be out of coverage per federal law. Now, here's the kicker. You can apply to HHS, Health and Human Services, for a 1-year waiver. Okay, an insurance plan can do that and get a waiver to still operate these mini med plans and insure all these folks. In order to do that, though, you must prove that there would actually be a major disruption in that market. Major disruption meaning a significant increase in premiums or a significant decrease in access to care. Okay, and actually some of these companies have gotten those waivers. Actually, I think the number is around 900 companies have received waivers. 900 companies covering 2.4 million people, or 2% of the total employer-sponsored coverage. 2.4 million people, they've gotten these waivers. And it just shows you that this law, unfortunately, can't be followed to a T, that the Health and Human Services, the government actually acknowledges that there's a lot of cases. In fact, almost 2.5 million people would be worse off if the law was followed exactly as written. So clearly there needs to be some changes, and there will be some changes. What this is going to do, though, it's already shut down some companies, some insurance companies. And as we all know from economics, less competition, prices increase. And unfortunately, that's what's going to happen here without some sort of change. Now, one other point I want to highlight on this before moving on to the pre-existing conditions is in the law, it actually sets a limit as to what companies can pay executives per deductions, meaning insurance companies can't pay executives over $500,000 a year and deduct that off their corporate taxes. The first $499,000 can be deducted, but any money over $500,000 is going to actually be at the tax at the full rate. This was designed, it may sound like a great idea, it was designed to keep costs down and curb, this high executive pay. Instead, it's going to have the opposite effect. I think you'd be challenged to find a CEO of a billion-dollar company willing to make under $500,000 a year. It just won't happen. Instead, those folks would actually leave that sector and go to other industries where they get paid what they think they're worth. Much like a lot of people a lot of doctors have actually left the medical profession because they don't think they're making enough money and gone to other sectors. The same thing would be true here. So instead, insurance companies are going to pay them, and they're going to take the big tax hit on it. It's going to hurt their bottom line. And shareholders don't like that. And companies need to make their shareholders happy. So what are they going to do? They're going to end up raising the premiums to make up that difference. So what happens as a result? All of us are actually going to be paying this extra payroll tax, not actually the insurance companies. But that's not actually what's gotten so many people in an uproar over this. It's not the dollar amount that is significant as much as the government singling out a certain private sector of an industry and putting a tax on their profits and executive pay. There's a lot of folks in the insurance industry say, hey, you have auto executives, property and casualty executives. They can make over $500,000, so how come a health insurance executive can't? It's a great question, something that's certainly going to be probably reviewed by Congress. All right, real quick, I know we had pre-existing conditions a little bit last time around. This is really good. There's an end to pre-existing conditions. There's an end to annual and lifetime limits to care. Quite simply, nobody can get turned away. That's a really good thing for people. It doesn't matter how sick you are, what you've had in the past, how much cost you've incurred in the past, you cannot be turned away for care. That's a very good thing and needed in the industry. The only problem is that that's going to come, as with other benefits, at a cost, and that cost is going to go into premiums. See, the only problem is that it removes the power of incentives, which, again, speaking economically, when you remove the power of incentives, you create an economic inefficiency. If you remember from last month's webinar, or if you've been following the state exchanges, everyone, through this individual mandate, everyone has access to care through state exchanges. And if you don't sign up, you pay a penalty. But that penalty is most likely going to be a heck of a lot less than the cost of buying health insurance. And if you don't buy health insurance, that's okay, because the minute you get sick and you need care, you can hop right in, buy the insurance, go get seen by the hospital or doctor or whatever, get treated, hop back off of it, and just pay the smaller fine. There's no incentive, there's no reward to maintain a healthy lifestyle. In the auto industry, there's a big reward. If you don't get into accidents and you don't get speeding tickets, you pay less in premiums. There's an incentive to be a good driver. Now, with the Affordable Care Act, there's actually no incentive to be a healthy person. In fact, the law prohibits people from paying different rates. The healthy can't pay any less than the sick. So what's going to happen is they're going to have the healthy subsidize the sick. And what I mean by that, again, if we look at the auto industry, I'm a horrible driver. If I've gotten into a few accidents in the past year, and my sister's a great driver, no accidents, no tickets, nothing in the past 10 years, okay, the law would say we need to be charged the same rates. Well, that's crazy, because I'm much more of a risk to an insurance company because there's a good chance I'll get into another accident or get another ticket. But if they're not allowed to do that, they can't charge separate, my rates aren't going to go down. I'm too much of a risk hazard. So they're going to have to raise the rates of my sister to equal the risk of me. And that's exactly what's going to happen in the health insurance industry. They're going to raise the rates of the healthy to subsidize that risk of cost for the sick. And the other thing, too, is because you can hop in and out of the exchanges, there's really not a pool of money, of reserves that's going to be built up to sustain it from the insurance companies. So there is going to potentially be a strong market disruption down the road.